On a Monday morning, I got up, I ran 6 miles. I went and did another CT, walked into a pulmonary specialist office and was told that I had lung cancer, which I promptly told them was an EMR error, malpractice, and I did not have lung cancer. I explained I had sweaty hair. My dad's a lung doctor. I've never puffed a cigarette and I'm fine. And he just kept looking at me saying, I understand that you don't think you're the picture of a lung cancer patient. I understand that you don't smoke a cigarette, but you have lung cancer. So that was a Monday, and I'm really lucky I did that scan because Tuesday the bronchoscopy came back with the adenocarcinoma, highly invasive cancer cell type. Wednesday in the pathology report. And after seeing the surgeon on Thursday and the nuclear medicine doctor for a PET scan Friday, they moved my surgery to Monday morning. So I only knew about my lung cancer for a week. They were nervous that it was so invasive. But again, I'm really lucky I did that scan and lucky that I can be here today as a survivor and a thriver. And, it hadn't spread to my lymph nodes. I had clear margins when they removed half my lung. And within 6 weeks, I was back to my 6-mile running loop. And this was just this past October, and in Thanksgiving and in December, I was back to skiing at 10,000 feet. So I caught it, I think, just in the nick of time and had the right, medical care around me to support it. And, was lucky that my husband pushed me to get the scan. And now I'm on a huge mission, Samira, because lung cancer is killing more young, healthy women than breast cancer and ovarian cancer and colon cancer combined. No one's talking about it. And I want other people to get the scan too.
Yeah. Shira, one, I'm sorry that you went through what you did, but I am also a little selfishly grateful because, and tell me if I'm wrong about this, but I think privilege plays a big part of getting good care in the US. Right?
Yeah.
Had you and your husband not been curious to get a scan that is not recommended medically, the medical community is actually somewhat pushing back on, is discouraging of, becomes the conduit to you catching something super early, I think is a marker of having access in a way I think a lot of people in this country don't. And I personally went through a lot of things that allowed me to have the outcomes I have because of privilege. And I would love for you to maybe take a stab at talking about that a little bit.
Yeah.
And how that factors into what you're trying to do now.
You're right. It is 100% because I have the right connections and the means to take care of everything within just, days and weeks time. Part of what I've started doing from the very beginning when I realized this is that I found that cancer doesn't care. It doesn't care if you have money or don't, or what color your skin is, or how many kids you have, or your age these days. And so I started a fund and a foundation in partnership that's called the Cancer Doesn't Care Fund. And you can learn about it on cancerdoesn'tcare.com. But the whole, auspice behind it is that it's not fair that I could pay for the scan out of my own pocket and others can't. So all the profits from my book called One Scan Saved My Life go to the foundation. And I'm working to raise money in other ways as well. And the idea is to pay for people's scans that can't afford it. So ultimately, for, let's say, the breast cancer space, we get mammograms starting at $40, and Medicare and Medicaid and insurance, private insurers are paying for that. And that's what I would love to see in conjunction with the mammogram, but a low-dose chest CT for your lungs. And until we can get Medicare and Medicaid and the private insurers to cover it, my fund, Cancer Doesn't Care, is there to pay for that scan. I also started working with individual facilities that administer the scan, and I've been really successful at lowering those prices. So one of the things I did is if you go on cancerdoesn'tcare.com's website, you can put in your zip code to find the nearest one near you. You can call them and ask how much their pricing is. I've learned that if you say that you do not have insurance, it makes it less expensive. I've worked with, for example, Vanderbilt. My first test was $777. I had it down to $450 by January, and now it's just under $200. So I'm also working with them on that so that if you can't afford a $770 scan or you can't afford a $2,500 MRI, I understand. I've gotten it closer to $200 and other places have been, even lower than that. And so I think there's two sides of it. One is to cover people's scans and the other is to just work with these, groups to lower it. We've found actually, I had some of the private insurers do some backdated look at their claims. And they found that actually if they paid these $200 scans for all their members over a certain threshold, age threshold or, risk threshold, that it was not only saving their lives, like for me, but it was saving money too. So we're kind of working, on both sides. So from the bottom up to pay for individual scans and the top down to get it covered.
That is incredible. I think a lot of times we actually need system change to get to where you want us to get to, which I agree with. And I appreciate all the work you're doing at the ecosystem level because I think you're spot on. I think unless finances come under control, I think moving the needle on screening becomes really, really hard. I think there's a second piece, and I'd love for you to talk about it, though, in lung cancer in particular, is stigma. I think a lot of people still believe that lung cancer is a smoker's disease, right? And we know that that's just not true. But there is this cultural narrative around that. And then, on the off chance you actually get lung cancer, there is an additional level of like, oh my God, even if I'm not a smoker, everybody believes that this is a smoker's disease, so I'm going to take on societal stigma. Can you talk about that a bit?
Yeah. So it's interesting, Samira, as a breast cancer survivor, I'm sure when you told people, oh my gosh, I was just diagnosed with breast cancer, people probably were like, oh my God, how can I help? Can I make you food? Can I pick you up? Can I drive you to your appointments? Can I, do all of these things? How did you find it? Where did you find it? Things like that. It's been interesting for me. When I tell people that am a lung cancer survivor, they say, oh, I didn't realize you smoked. And I always say, oh, okay, you've known me for 40 years. You know my dad's a lung doctor. You think I'm hiding packs of cigarettes from you and you've never noticed? I mean, the reality is that the smoking cessation campaign was so successful that people started saying, if you smoke, you get lung cancer instead of if you have lungs, you can get lung cancer, And I think the stigma around it is tough. I think that if you do smoke, it's not your fault if you get lung cancer. I hope that you can get your screens and take care of yourself. It is very and highly addictive. It's not, it's an addictive drug, alcohol. There's so many. It's not their fault. And so smoking individuals shouldn't be penalized for it. They should, not be, shunned or looked down upon. And then the other side of it is, like I said, if you have lungs, you can get lung cancer. So we should pay attention. There are other risk factors. So for me, in my lung cancer, we haven't figured out what my risk factor was. I mean, I have it. It's clear. My book, like I said before, One Scan Saved My Life. They actually put a picture of me on the front of the book, and I was very uncomfortable with the publisher in the beginning. And he said, no, we need your picture on there. You don't look like, somebody who has lung cancer. And I realized you're right. I'm not the Marlboro man with like the black coal lung. And I think it's a tough, view to see. A young 40-something-year-old woman with 4 little kids is the one that's getting lung cancer. The reality is that the United States Preventative Services Task Force has put guidelines out there, which Medicare and Medicaid and the private insurers follow, that says if you're over the age of 50 and you smoke a pack a day for 20 years, we will cover your low-dose chest CT. Well, the reality is that if you are an individual who's over the age of 50 and smoked a pack a day for 20 years, because of the stigma around smoking, a lot of those patients don't tell their doctors the truth. They don't order the low-dose CT. They're finding actually less than 20% of people that meet those guidelines are even getting the scan. And sometimes I think if we drop those guidelines to be over the age of 40, period, or like a mammogram or some of these other low-hanging fruit, if there's a family history, if it will help increase the number of people that do get scanned that are the smoking individuals, as well as increase the number of other people, because they'll be sitting in the hospital waiting room to get a low-dose CT with other people that they're not as uncomfortable to be around. It's not as much stigma. When I was doing my research, Samira, I think I told you this before, breast cancer survivors have a 2-fold increase of getting lung cancer as a primary cancer within 5 years of diagnosis, not because of radiation or treatments, nothing else, just, lightning striking twice, bad luck, breast and lung. And I think that if we realize that and we see that in the data and we add that, it'll help with the stigma. It'll help with the stigma for people like me who don't smoke and end up with lung cancer, and help with the stigma for people that do smoke and should be screened for lung.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors.